Hi, Dr. Yass here. Today I am going to discuss the issue of bone on bone. I believe it right now is the largest misdiagnosis being provided worldwide to everybody who has pain somewhere in the region of typically the hip or the knee joint, and yet the only mechanism that is being used to help to identify that by the medical establishment is an X-ray. And the X-ray shows decreased joint space, which then is rationalized as being bone on bone. But they are actually two completely separate things. The phrase bone on bone implies zero joint space. Not decreased joint space, zero joint space. The X-ray is incapable of identifying whether even minimal joint space exists. And certainly, you would have to think that the fact that this X-ray is being interpreted by an orthopedic surgeon who performs surgery, that possibly there is a chance that there's a lack of understanding exactly whether bone on bone actually exists or whether there is even a small portion of the joint space that exists. And that is a monumental understanding as to whether surgery is required or not. There are a multitude of indicators that people who are being told they're bone on bone, in fact, are not. I have been treating the issue of pain for over a quarter of a century. I have treated thousands of people scheduled for hip and knee replacements, and in all but possibly 2 or 3, that's thousands with an S, the person presented with a physical presentation that indicated they were clearly not bone on bone. And therefore, that diagnosis was incorrect, even though you were shown, or the person was shown the X-ray showing diminished joint space, and those people were stopped from getting an unnecessary surgery. Unfortunately, there are millions worldwide who are not so lucky and have gotten an unnecessary joint replacement, which has led to greater symptoms, which leaves the person suffering with chronic pain. And upon asking the surgeon, why am I still having pain? The answer is always the same. And that is, I don't know, the surgery looks perfect to me. So it's time for you to have a reality check about what bone on bone actually represents and where the symptoms would be if in fact bone on bone was creating your symptoms. This is the key to understanding what is the cause of symptoms, or in fact, what tissue is in distress eliciting those symptoms. That is the basis of the Yost method. It is completely separate from the existing medical model that simply uses a diagnostic test. The diagnostic test is baseless. The diminished joint space that you're shown has been there for 20 or 30 years. It's taken that long for it to diminish, to degenerate. And you're only having symptoms in the last week or month. How could anyone justify something that's been there for years is suddenly creating your symptoms the last week or month? It's invalid. It's baseless. But the scam of the system is that it's always getting that X-ray at the time you're having symptoms. So therefore, the identification of this decreased joint space is only identified at the time you have this symptom, and therefore the assertion is made by the medical establishment that therefore it must be causing the symptom. But if you had had the X-ray a year, 5 years before your symptoms began, you would have seen the exact same joint reduction, the minimization of that joint space, clearly indicating it existed well before your symptoms began, and therefore there is no justification for the assertion that that's creating your symptom. Let me just briefly start with a little bit of an understanding of what a joint is and then we'll move on to what symptoms you would expect if you were having bone on bone, and where people typically have symptoms, which is impossible to be created by some alteration in a joint. So to start, we talk about what is a joint. A joint is basically comprised of two joint surfaces that approximate one another, and there's a space that sits between them, typically maintained by a meniscus cartilage or a labrum cartilage. The reason that that joint space is maintained is because of the fact that the bones that approximate one another don't move in a perfect position. They don't move like this. They actually glide on one another. There's actually a movement occurring in the joint where the bones are gliding on one another, which allows you to perform your range of motion. So a joint space is required to allow this gliding to occur. If you were in fact bone on bone, and let's be clear, bone on bone implies zero joint space, not a tenth of an inch, not a thousandth of an inch of joint space, zero joint space. If you were in fact bone on bone, these joint surfaces would not be able to glide. They wouldn't be able to move, which is a requirement for you to perform your range of motion, to create range of motion. And therefore, there would be a major loss of range of motion. So if we were talking about the knee joint, you'd be able to move your knee like this. And then if you were bone on bone, you'd probably end up somewhere here. Very, very limited. And when someone would try to push you through beyond that limitation, it would feel like a bone is hitting another bone, limiting further motion. That is the required physical presentation that indicates whether bone on bone is present. What is found on an X-ray is meaningless. It's an incidental finding. It is not a rationale for the diagnosis of bone on bone. There's only one indicator that bone on bone is present: a major loss of range of motion, and at the end of that range of motion, if you try to push through further, it feels like a bone is hitting another bone. That loss of range of motion with a bony end feel at the end range is what the Yass method looks for to indicate that an individual is bone on bone. Other than that, if full range of motion is experienced, you are not bone on bone. This has to be understood unequivocally. You will be manipulated to get a surgery by an individual who does surgery for a living by showing you an X-ray which shows a diminished joint space and tries to justify that that diminished joint space is an indication of bone on bone. And yet, if you were to go through range of motion, you would see you have full range of motion. You are not bone on bone. That is a fallacy. You will be getting a surgery you never needed. It will increase your symptoms greater, and you will be left suffering, while the surgeon will simply look at you and say, hey, I don't know what the story is. I did the surgery, and the surgery was perfect. You need to be educated. You need to protect yourself. You need to understand how to interpret the symptoms that are being presented that represent a tissue in distress. The tissue in distress is the tissue eliciting the symptoms. It's attempting to create conscious awareness of the distress of the tissue so that an intervention can be performed to that tissue. And once the distress is resolved, the tissue no longer has to elicit the symptom, and your symptoms cease. For all of you who have had a joint replacement and are continuing to have the same symptoms, what do you think that represents? It represents the fact that the wrong tissue was treated. That's what it represents. And you're now going to go back to the very person who clearly was incapable of identifying the correct tissue, treated the wrong tissue, and now wants to do something further to try to resolve your symptoms? I mean, clearly there's a problem there. So I want to briefly just give a quick little anatomy test or presentation so you can see once and for all where your hip joint is. When I talk to people and I say, show me where your hip joint is, nobody knows where your hip joint is. And that is a rather important thing to understand. This is your hip joint. This is your pelvic rim. The majority of people have pain in here. That's not your hip joint. That's called the gluteal fossa, and that's where a muscle sits. For those people who have pain in the groin, joint pain can only create pain, guess where? In the joint. So unless you're having pain just at your joint, which could be indicated by somebody pushing in, if you're laying on your side, pushing in on the hip joint to cause the pain to occur just at that hip joint, your pain anywhere in this region is not coming from the hip joint. Groin pain is not coming from the hip joint. Lateral hip region pain, or the above the hip joint in the pelvic region, is not coming from it. Gluteal region pain is not coming from the hip joint. This is your hip joint. To find it, you would need to find the top of the pelvic rim, run your hand down the side of your pelvis about 4 or 5 inches, and you'll feel a bony protuberance. That's your hip joint. If your pain is anywhere other than there, your pain is not coming from your hip joint. There is no possible reason to believe that the cause of that pain is even associated with something as absurd as bone on bone. Let's briefly look at the knee. This is the same type of situation where people are being told that the cause of their pain, if you had bone on bone, this is the joint between the thigh bone and lower leg bone. Your pain would have to be here or here. These are known as joint spaces, the joint line, the medial and lateral joint line. If you don't have pain or here and your pain is around your kneecap, that can't be from bone on bone. It's a separate entity. This joint between the kneecap and the thigh bone is independent of the joint between the thigh bone and the lower leg bone. So pain that's associated with bone on bone has to occur at the joint lines, not around the kneecap. Pain around the kneecap is unassociated with being bone on bone. That is the best way for you to understand what is causing your symptoms. It is education, it is understanding. Is the ability for you to understand what you're being told and determine on your own whether what you're being told is valid or not. Bone on bone cannot be identified through an x-ray. Only the physical presentation of a major loss of range of motion, and at the end of that range of motion, the feeling that the limiting factor is bone on bone, preventing the joint from going through further range of motion, is the only presentation that justifies being bone on bone. There are a multitude of muscular causes that create symptoms in the hip region and knee region. This is the result of your inability to perform your functional tasks without having the appropriate strength of all the muscles that are associated with creating those tasks. 95 to 98% of cases of pain are muscular-based. These do not show up on diagnostic tests. Those people you're going to in the medical field, regardless of their specialty, are incapable of identifying these muscular causes. The number of people suffering from chronic pain has done nothing but rise since the use of diagnostic tests. Why is that? That is because in most cases, the cause of pain is muscular. It is more of a fitness-based idea where you don't have enough strength in all the appropriate muscles. It has nothing to do with the medical cause. That is why the medical system cannot resolve your symptoms. You need to find the Yass method. If you want to find the Yass method, you can go to my website, www.mitchellyass.com. You can email me if you have a question or would like to set up an appointment to get treated so you can have your pain resolved and get your functional life back. You could do that at drmitch@mitchellyass.com, DRMITCH at MITCHELLYASS.com. You can go to my YouTube page to see more video at Dr. Mitchell Yass, or my Facebook page, also at Dr. Mitchell Yass. Whatever it takes, get the Yass method. It is your only hope of getting your pain resolved and